Good evening, I'm Andrew Chang.
And I'm Adrienne Arsenault. Tonight, Quebec cracks down in the face of skyrocketing COVID cases.
If everyone does their part, we can get through this together.
New restrictions and no fans in the stands for the Habs tonight.
We're starting to have a normal life back, and here we go again.
Across the country, the scramble for booster shots and rapid tests, while Ontario scientists warn
this will likely be the hardest wave of the pandemic.
So is Omicron changing the game? We answer your questions.
As a fully vaccinated individual, do I still need to isolate like I did in 2020?
Plus, at issue on how politicians deal with COVID fatigue.
Also tonight, while P.E.I. farmers are stuck sitting on their potato crops, their premier has a message for Ottawa.
It's time to get rid of this silly BS and let's get to work.
We're with the delegation in D.C. as they try to undo the export crisis.
And Rudolph versus a real-life deer. The perfect viral video for the holidays. This is The National.
With just over a week before Christmas, Canadians are trying to wrap their heads around a rapidly changing pandemic landscape.
But before we get to the latest complications brought on by the Omicron variant, we want to spend a minute with a significant number. As of tonight, 30,000 Canadians have died from COVID-19. And of course, thousands more lives changed forever. And some scientists are warning this could be the toughest wave yet.
As Omicron spreads in almost every part of the country, provinces are facing some pretty difficult choices about how to slow the spread. In Quebec, with cases surging higher and higher, new public health restrictions announced tonight. And in Ontario, with a mad scramble for booster doses underway, new modeling is giving a clearer picture of where this could be going. And the real worry beyond skyrocketing infections, the toll Omicron could take on hospitals and intensive care units. We will have comprehensive coverage on all the latest Omicron developments. That means, of course, making time for your questions. But we begin tonight with the new measures to combat the variant and what they mean for you. Here's Katie Nicholson.
A late game day decision in a bid to control COVID. No fans allowed.
We're starting to have a normal life back. We all did the vaccinate. I'm both vaccinated, and here we go again.
This on the same night Quebec's premier announced new restrictions.
If everyone does their part, we can get through this together. I'm counting on you all.
The 39 new measures include a return to work from home, places of worship, restaurants and bars back to 50% capacity, personal gatherings limited to 10, all to take effect Monday.
It's for a good cause, and let's see what's going to happen, man. But just before Christmas, come on.
Further east, Nova Scotia blew past its previous daily case record set last May, posting 287 cases. New Brunswick, too, set its own new single-day record of 177 cases.
The public is done with COVID, but COVID is not done with us.
You need some rapid tests? There you go. Have a good holiday.
Even St. Nick trying to keep people safe ahead of the holidays.
That's a rapid test.
In December, mall lineups this long are usually for the hot toy of the year. In Toronto, it's for rapid tests, slowly rolling out at select locations amid fears more measures could be coming.
I'm getting the rapid test because we're actually going to do Christmas a week early in case they lock down.
In Ottawa, more lines this time for booster shots.
We didn't get in there until 25 after 11 for a 9:40 appointment.
And then you had to wait inside for about another half hour before we got our shots.
Saskatchewan Premier Scott Moe also banking on boosters.
Effective Monday, December the 20th, we will be opening up that eligibility age to all of those 18 years and older.
While in Alberta, where the unvaccinated are newly allowed to mingle with others at private indoor parties, there are concerns that could fuel the spread.
With Christmas and loosening of restrictions, it's really the perfect storm to make January one of the worst months we've had.
And on the West Coast, even more lineups. These for testing kits. A surge in cases, 753, 200 more than Wednesday, and a sharp uptick in confirmed Omicron cases.
So, Katie, clearly we're seeing surges in lots of communities, but it seems that there's one Ontario city that's getting hit really hard.
Yeah, in case there was any further doubt as to how much of a juggernaut this Omicron-led wave could be, Kingston, Ontario, just 2.5-hour drive from here, has the highest rate of infection in the country. It's so high that contact tracers just can't keep up with it. We heard today from the Ontario Science Table, if that rate were here in Toronto, we'd be looking at 10 to 20,000 cases right now. Adrian?
Wow. All right. Thank you, Katie. Katie Nicholson in Toronto.
So what could the Omicron wave look like in the coming weeks? Katie mentioned that new modeling out of Ontario. It paints a dire picture. And as Tashana Reid explains, scientists say without more measures, cases will quickly overwhelm the healthcare system.
Ontario's top COVID scientists called today for a circuit breaker and asked people to reduce their contacts by half.
This will likely be the hardest wave of the pandemic.
Ontario's Science Advisory Table says cases are doubling every 2 days. Without changes, the province could see between 6,000 and 10,000 cases per day by New Year's.
Because of the speed with which it spreads, the cases that we see today, the cases that we see tomorrow, the cases we see on Sunday, will be the hospitalizations in 2 or 3 weeks from now.
They warn ICUs could get overloaded fast.
The numbers that we're expecting are so much higher than we saw during wave 3. And that's really a feature of how quickly this virus is spreading and how much more transmissible it is.
Lab research from Hong Kong, not yet peer-reviewed, tries to explain why it is so contagious, finding Omicron multiplies 70 times faster than the Delta variant in the bronchus, the passageway from the lungs, and may be slower to replicate in the lungs. The researchers suggest that may result in milder illness. But as Omicron spreads in the real world, the picture around its severity continues to develop. Despite early data from South Africa indicating a milder illness, the country is now seeing an increase in its hospitalizations and ICU numbers.
I hope you're going to survive. We'll do the best we can, okay?
Data from Denmark shows Omicron's hospitalization rate is similar to Delta, as the country struggles with its own surge. For now, researchers say with all the unknowns, provinces and territories need to do what they can to get ahead of this variant.
We need to prepare as much as possible in the time that we have to try and blunt this. The ability to stop this is likely gone. It's already here, it's already moving.
Tashana Reid, CBC News, Toronto.
Now, infectious diseases specialist Dr. Suman Chakrabarty has been following along. Dr. Chakrabarty, restrictions, I mean, they ebb and flow, right, depending on where you live. But what about the universals, the kinds of masks we wear, the physical distance we keep, the time we spend with others? Given how contagious Omicron is, are those fundamentals less effective?
I think the answer to that is yes, and I think that we have to rethink our entire approach. This is now a virus that's going to essentially expose all of us, and trying to keep away from it is not going to work very well anymore. But the good news is we have vaccination as protection as well as post-infectious immunity. These things together are going to allow us to coexist with the virus safely. And again, I always tell people that this virus, as time goes on, we have protection against it. We can get the vaccine for it, and I think that we can do this in a safe way. This is a much different situation than it was a year ago.
What segment of the population should be paying the most attention right now? Who's most vulnerable?
We know that individuals over the age of about 60 have the most vulnerability to infection by COVID. People who are unvaccinated, those with things like obesity, diabetes, high blood pressure. And I think these are the population we really, really want to get first doses into if they haven't gotten it. And if you've gotten 2 doses, get that 3rd dose because it really is going to help. I think that targeting this especially is going to be important in the coming weeks.
Okay, Dr. Chakrabarty, you're going to be back in about 15 minutes' time to answer some viewer questions, so don't go too far. Thank you for this.
Now let's look at the COVID situation across the country tonight as the cases keep rising. So this is Canada's epidemic curve, moving the wrong way. The rolling 7-day average of daily new cases now at its highest since May. The big unknown, what Omicron means for Canada's hospitals. So for now, those numbers are stable, at least on a national level. We are well below what hospitals faced during the spring wave. And after a moderate uptick earlier this fall, Canada's hospitals have been steadily treating about 1,500 patients. But Before you even factor in Omicron's potential impact, some of the country's healthcare systems already feel the strain. As Cameron McIntosh shows us, Manitoba hospitals can barely find spots to put their severe cases.
Omicron is barely even in Manitoba right now, yet the system is teetering. ICUs are near full. Burnout has left staff shortages, meaning fewer beds.
I've been here since 8:30 this morning.
Seeing it coming this morning, a lineup in a minus 25 wind chill for walk-in vaccines.
And I don't want to wait till January or February to get my booster shot.
I think as soon as possible is a good way to go.
The modeling here is stark. Up to 1,000 new cases a day by January.
Once we see this spreading in the community, we are weeks away from it being our dominant strain.
Now that's almost double what Manitoba saw in the third wave, when it was one of the worst hit places in the country. Heather Stephenson was health minister then. She's premier now.
Please get vaccinated.
For now, she's resisting calls for more restrictions, as her health minister looks to manage the full ICU and a growing surgical backlog by trying to free up staff, moving non-critical patients around the province out of Winnipeg, at least 45 a week.
We have been able to surge up our capacity in ICU.
This is the best choice out of few or absolutely poor choices available. How did we get to this? That's the fundamental issue.
Predicaments others worry will play out elsewhere. In Quebec, where the healthcare system is short thousands of workers, modeling is also worrying.
We're sure that there's going to be an increase in the hospital beds needs.
While all across the country, frontline workers complain of burnout.
The nurses are just done. They are absolutely finished.
Our healthcare system is in critical condition.
Now, in the case of Manitoba specifically, a request has been made of the federal government. 30 ICU nurses, likely military. The federal government says it's assessing it along with the needs of others. Cameron McIntosh, CBC News, Winnipeg.
So ensuring Canada's hospitals don't get crushed relies on policy, but what can politicians do when the people are just exhausted? At Issue picks up that part of the conversation ahead.
Well, one of the federal government's COVID relief programs is under scrutiny. CBC News has learned that a private ski club in Ontario accumulated hundreds of thousands of dollars in surplus and new equipment after receiving government funds designed to help companies avoid layoffs. And as Jonathan Gatehouse tells us, they're not the only ones.
It's not the biggest ski hill, but the cost of joining Mansfield is steep. A $15,000 membership fee plus up to $10,000 in yearly dues.
Hi, I'm Chris Delhaney, your general manager.
In this private video for club members, Mansfield says there's a lot of improvements to look forward to this year.
Here we are standing in front of what amounts to about 18 hours of snow production.
Snow guns, compressors, new member washrooms. And according to this leaked treasurer's report from September, all this capital work was made possible thanks to the club's solid financial position, primarily driven by the wage subsidy. Financial statements show Mansfield received $563,000 in government wage subsidies, which along with a record number of new members and decreased expenses resulted in a hefty $815,000 surplus. Last year's shortened season was so profitable, in fact, Mansfield would have recorded a $250,000 surplus even without federal money. While there's no indication the club broke any rules, these financials raise questions why this club was subsidized in the first place.
The money went to a business that didn't really need this money.
Economist Miles Korek says this is one example of a poorly designed program with minimal oversight.
Many public finance economists will see this program as probably the biggest waste of public funds in post-war Canadian history.
Mansfield representatives declined interview requests. The Canada Revenue Agency, which oversees CEWS, says it has started around 3,200 audits, covering a small fraction of the program's almost 457,000 recipients. The agency says it's too early to report their findings. A CBC News analysis found 885 additional golf, tennis, ski, and yacht clubs received government funding. But there's no public information on how much they got or what they did with that money. Jonathan Gatehouse, CBC News, Mulmer, Ontario.
A Canadian was among 12 hostages released in Haiti today. They were part of a group of 17 missionaries kidnapped in October after visiting an orphanage just east of the capital, Port-au-Prince. 5 other hostages had been released in recent weeks. CBC News has learned that all the freed hostages have left Haiti as of tonight.
On the heels of the historic apology to those who experienced sexual assault in Canada's military, Ottawa has now laid out a plan to tackle the crisis and overhaul the workplace culture in the Canadian Armed Forces in 5 years. Ashley Burke takes us through it.
Justin Hudson says he left the military a decade ago because of sexual assault. Now he wants to return as the military promises a change in culture.
It has to change because victims of sexual misconduct and sexual assault, they were not being heard and their careers were being directly attacked by the chain of command.
Hudson says he knows that firsthand. Civilian prosecutors are currently reviewing his claims to determine if charges should be laid against 2 of his former aerospace engineering classmates. He alleges they repeatedly sexually harassed, groped, put their genitals on him, and in one instance attempted to rape him. But he says his chain of command at CFB Borden failed to act.
Almost nothing was done. It wasn't taken seriously. They did not see any of the symptoms.
I am sorry.
2 days ago, a historic apology from the military and the government, but some said they wouldn't accept it without an action plan. Today, they got this.
The horizon that I'm working with right now is 5 years to have instituted and effective, irreversible, positive changes.
To do that, the military plans to expand services at its Sexual Misconduct Response Center to civilians and veterans. It also plans on developing a program to provide independent legal advice to complainants and to continue its consultation process about what to do next.
Right now, what we're seeing is small steps, but we're not nearly enough towards a comprehensive culture change.
Hudson's getting his life back on track and says expanding the Sexual Misconduct Center, a resource he used, is a start.
It helped me gain the confidence that I needed to come forward.
But he says 5 years is likely not enough time to fix the deep cultural problems he witnessed. Ashley Burke, CBC News, Ottawa.
In the U.S. Midwest, a powerful, unseasonable windstorm has left at least 5 people dead. Howling hurricane-force winds hit several states as people fled to safety. Hundreds of thousands of homes and businesses left without power. Experts say a storm system like this at this time of year is really unusual, driven by unseasonably high temperatures. It's the second round of extreme weather for a region that saw less than a week ago one of the deadliest tornado outbreaks in U.S. history. The effects of the system are also being felt here in Canada. Strong winds caused glass to fall today from the elevator shaft of Toronto's CN Tower. There were no injuries.
Well, in the Philippines, nearly 100,000 people have been forced from their homes as a powerful typhoon batters the southeastern part of the country. Typhoon Rai blasted ashore with wind gusts as fast as 300 kilometers per hour, causing widespread outages, flooding, and destruction. Many people forced out of their homes. In Australia, 5 children are dead after a tragic accident involving an inflatable bouncy castle. Authorities say several grade 5 and 6 students were taking part in an end-of-year celebration when a gust of wind blew the castle 10 meters into the sky. 5 other children are being treated in hospital.
After Ottawa tells Canadians to take a pass on the non-essential trip, those with travel plans are figuring out what to do.
I just worry that we would be stranded.
Coming up, weighing holiday travel and what to know if you're ready to cancel. Plus,
we're all tired and wanting this pandemic to be over, but we're not done. Not yet.
Politicians are asking for caution again, but some are getting tired of listening. Will the message get through? Rosie and the At Issue panel are here.
And Rudolph may not lead Santa's sleigh this year if this deer has anything to say about it.
Oh my goodness, here he goes.
We're back in 2.
Welcome back. Almost 2 years after COVID-19 officially landed in Canada, Omicron now threatens to push us into the unknown as it spreads faster than any version of the disease we've seen yet.
So we've been putting your questions to the doctors about what Omicron means for you and your family and how to navigate the uncertain days ahead. And the questions just keep coming.
Indeed. So we are going to get you some answers with infectious diseases specialist Dr. Suman Chakrabarty. Thank you for being here. Let's start with the first question.
Hi, my name is Ramsey, and my question is, as a fully vaccinated individual, do I still need to isolate like I did in 2020 with this new Omicron variant? Or can I still go out for drinks with my vaccinated friends? Thanks.
What do you think?
Look, we're 2 years into this. We have almost approaching 90% of eligible people vaccinated on the ground. This has now become a personal risk assessment. We know the things that we can do to make things safer. And I think also we know that our best defense is vaccination. So if you haven't gotten vaccinated yet, I urge you to do so. But after that, it's what you're comfortable with and what the party you're with is comfortable with. I think it's past time us telling what people should be doing in their own homes.
But can you quantify the protective effect of being vaccinated against Omicron versus, say, being not vaccinated at all?
Yeah, when we look at some early data coming out of South Africa, it looks a little bit dismal. It looks, the number was for Pfizer, if you have 2 doses, is like 35%. But we have to remember to distinguish between infection and severe disease. Infection can just be having a runny nose and sore throat. But severe disease is what is important to me. And it says it's about 70% protective. The other thing to remember is when you have a population where there's been lots of exposure and the unvaccinated people also have quite a bit of immunity, this calculation gets tricky to do. So I actually think it's probably quite a bit higher than that. The point is if you have 2 doses of vaccine, you're quite protected against severe disease. And if you're eligible for a 3rd dose, especially if you're over the age of 60, I urge you to get that, especially with that and immune compromised conditions.
All right, let's go to another question. This one is from George Brown.
My question is, as Omicron takes over, what happened to Alpha and Delta? Did they go away, or are they still as prevalent as they once were?
Okay, it's a pretty good question. Where are those other variants?
So with Alpha, it's kind of gone. What happens is these viruses have competitive advantages against each other, and they can essentially crowd out the other one unto extinction. Right now, we don't know what's going to happen with Delta. It looks like in most places, Omicron will completely displace it, but there is a possibility that the two can kind of compete with each other and become co-circulators. So time will tell. I suspect, my guess is that Omicron will completely displace it, but Delta is a pretty big beast as well. So we'll see. It's going to be a good battle, but time will tell us what the final answer will be.
So just so I'm clear, does that mean that the original COVID virus that we all saw almost 2 years ago is now gone?
Possibly. I suspect it's probably there in certain very small regions. It probably can be found. But as a worldwide type of virus that was circulating broadly, yes, in that sense, it's gone.
We've got one more question for you, Dr. Chakrabarty. Let's listen to it.
Hi, I'm Miranda Jimmy, calling from the heart of Treaty 6, Amisquachi, Wiscahican. My question for you is if booster shots or 3rd doses are considered so important in the fight against COVID variants, will the definition of fully vaccinated be changing from the current 2 doses to 3 doses?
2 doses just not enough?
This is, I think, an answer we're going to have once we look back on this and have more data. I do think that certainly for individuals who are over the age of 60 and have significant immune compromising conditions, fully vaccinated would mean that you need the 3 doses. And for less age than that, 2 doses are probably protective. I think the sticky part of this is when you get mandates. And I think that we have to remember that this is not a one-size-fits-all type of vaccine, because somebody who's 80 has a much different risk than somebody who is, for example, 20. So we have to keep all these nuances in mind and be careful. But it is definitely certain that getting vaccinated is still the best thing that we can do against this virus. And this is one of the reasons why we're in the position now where we have a population that's approaching 90% and has significant protection against severe disease.
Because even at this point, do we know how much immunity is dropping off, even for someone who has 2 doses?
Yeah, right now it looks like the protection against infection, meaning getting exposed to the virus and having some symptoms, has dropped off and generally drops off between 3 and 6 months. But data that's accruing right now is still showing that the protection against severe disease, meaning sick enough to get hospitalized, is still pretty well maintained if you're under the age of about 60. So I think overall it's a very effective vaccine to protect against severe outcomes, and I suspect that's going to be a long-term type thing, but again, time will tell.
Dr. Chakrabarty, thank you so much for your time.
Great to be here. Take care.
The Premier of P.E.I. is fighting back against Ottawa's potato export ban.
Really, Team Canada? Let's act like Team Canada.
Now he is appealing for help in Washington. But first, Rosie's here with that issue.
Adrian, as you well know, the Omicron variant taking over the political discourse these days as well, and there's lots to talk about. A new travel advisory, new gathering limits and restrictions in some provinces, but are Canadians willing to change their holiday plans? Chantal, Althea, and Andrew with all of us right after this.
My message to Canadians, first and foremost, is I understand this sucks. This is not what anyone wanted for our Christmas holidays.
Yesterday, amid growing concern over the Omicron variant, the federal government announced new advisories against non-essential travel, and some provinces have now altered their public health measures ahead of the holidays.
The notion that we could just, cancel Christmas in an excess of caution, I don't think reflects what Albertans would be willing to tolerate.
We've been in this fight for almost 2 years now. We're all tired and wanting this pandemic to be over, but we're not done, not yet.
So, after almost 2 years, are Canadians tired of heeding advice from their politicians? It's Thursday. I'm here with, at issue, of course, Chantal Hébert, Andrew Coyne, and Althea Raj. Good to see everyone. So, new advisories against travel. Some provinces like Ontario reducing capacity limits. What are we making of the way politicians are responding to the threat of this new variant at a moment when there is, it seems, a lot of fatigue, rightly so, inside the population? Althea, you want to start?
I think politicians have learned to take decisive action quickly and are waiting less than what we saw last year. Is it quick enough? I think a lot of people would say no. I think you're also seeing the federal government at the Liberal Party is taking a more prudent approach. We saw on a call this week that they were hoping that the premiers would agree to the banning of foreign travelers, people coming to go skiing, for example. There was pushback from the premier, as you see in Ontario right now, where you could still go to the restaurants and there's no capacity limits on that. And in Alberta, for example, that's probably not the response that you would expect. You're even hearing it in the Conservative Party, who is being, Aaron O'Toole is not telling his MPs, for example, not to travel. Yet last year, David Sweet basically got, tossed out for going on a vacation. So there are different approaches to managing this crisis, and I think federally what you're seeing is that whoever is in that hot seat, the minister, really does matter. I think that there's a different tone, a more forceful tone because of Jean-Yves.
Certainly more decisive. I think that seems to be the case too. Chantal, go ahead.
Yeah, well, it's one thing to sound decisive, and it's another to have the capacity to implement the so-called decisions that you made. The case of the decision that we were going to test some travelers that come in through airports, but not some others, when we never had the means to test actually most of them in any event, was a great example of the difference between what you want to do and what you're able to do. And I think what happened to the Prime Minister with the premiers this week was that he also suggested they should restore quarantine and testing at the airport, but they don't have, and the provinces do not have people to spare to do that. And so after all this time, you would want them to think about something that makes sense rather than something that sounds decisive.
Yeah. Andrew.
Yeah, you're seeing a more rapid response, shall we say, and more forceful sounding, but it's striking when you look at the types of measures that are being proposed. They're generally things that don't ask a lot of sacrifice of people. So we're going to get a lot more booster shots, we're going to get a lot more tests, but we're not going to see much in the way of, lockdowns and restrictions and movement. Maybe that's appropriate. Maybe that's the stage we're at now, but I think it's also a recognition of public fatigue.
Yeah.
And I wonder whether that's an unfortunate situation, because I fear that we're once again falling behind the exponential numbers. This thing is going to grow, it's doubling every 3 days. And it's hard for us to wrap our mind around that. So people are once again saying, what's all the commotion? Nobody's died from this yet, for example. I'm afraid we may once again fall behind the curve of what's actually necessary.
Chantal, you went in there?
I'm not sure.
Yes, I do think that it's not just people's fatigue. I think it's government's fatigue. They thought they were home safe up to a point with vaccines.
Yeah.
Now, not only are they finding that they're not, but I don't think they've gotten their minds completely around the reality of what's happening and what that is going to mean. And if they let it go for very much longer, and they are up to a point letting it go, I don't know what this will look like in January.
Althea?
I expect we'll have lockdowns. You can't listen to the science tables and see their modeling and think that everything's going to be fine if we just continue the way we're going. It clearly is not going to be fine. I want to go back to Chantal's point because I think it's a really good one. And when the federal government here came out with the border measures saying that everybody coming from flights abroad would have to get tested, not people from the U.S. though, they didn't have the implementation measure. And I think that the lesson that was learned in the past 2.5 weeks was they really wanted to get their ducks in a row for this week's announcement. And so, I mean, it's sad that it's come to that point, but when you look at the AG's report from, the pandemic, the lack of checks, the kind of the chaos that you have rules, but they're not actually followed, at least, it's sad that it's taken this long to get to where we are, but at least the government is recognizing that implementation is a key part and it's not just the announcements.
So the fact that there's all this different kind of political messaging, because it doesn't seem coherent, certainly from one province to the next ahead of the holidays, because they're taking different approaches and federal advice is different. We don't recommend you travel, but you're not banned from doing it. How does all that sort of factor into how people are supposed to deal with this and how politicians deal with it? Chantal, yeah.
I think the fact that it's Christmas and the holidays, that's throwing a major wrench in anything that governments want to do, be it administering boosters. The people who work in the healthcare system certainly expected to take a bit of a breather for Christmas. Are you seriously going to tell Canadians that suddenly they're going to have to stay home on December 15th? After having allowed people to buy plane tickets and having no way to actually stop them from going. And when I talk about the difference between sounding decisive and actually implementing, I don't just mean Justin Trudeau and his government, who I believe have failed that test 2.5 weeks ago. I also include provinces that say we're going to offer boosters to everyone 18 and over. Yes, okay, but do you have the means to do it? And do you know that you're actually giving those boosters to the people who need it most? I'm not so sure.
Andrew?
Everyone was taken by surprise from this. Everybody is scrambling to catch up, and therefore you're getting a lot of mixed messaging. And as Chantal says, a lot of wishes and hopes that might be taking the place of actual policies. I don't doubt that we may yet end up in lockdowns, but we'll wind up with them 2 or 3 or 4 weeks too late. And as I say, once again, the numbers the arithmetic of it is going to confound us. The evidence does seem to be that this is a milder virus in its effects. But if you get enough cases, then even with a lower, death rate per cases, you're still going to have a lot of deaths.
Yeah. Althea, last word.
And even that's not actually totally clear. I just want to go back to something you said about the not travel. I feel like at some point people need to take their responsibility for their own actions. The federal government, it will take them a lot to say, do not travel. They tell you don't travel to Afghanistan, but, avoid all unnecessary travel basically means don't travel. They have said don't travel like over 9 times during that press conference this week, and they have been laying the groundwork for that messaging for the past few weeks. If you go abroad, you could get COVID, and then you're stuck, and you have to pay that bill, and your insurance may not cover you. And the government, why should it be to the taxpayers who've followed all the rules to come pay for you to leave that other country? You might not even be able to get on a plane if you have COVID. People need to realize that it is a risk that they are taking themselves, and it should not be up to the government to come and save them.
I feel like Chantal has one more thing.
Yes, except that when you live in a province, I'll name Quebec, and the health minister 4 days ago is saying it's okay to party with 20 people. This is 4 days ago. Today, hospitals, because hospital workers are not safe from this variant. Hospital workers are going to Christmas dinners and falling ill. How would you want people to say, I need to take my responsibilities when they're getting all these conflicting messages?
So, some people need need the message, to be clear, and don't take the personal responsibility. Okay, that wasn't the most uplifting panel we've ever done, but thank you very much. I appreciate it. Before we go, be sure to subscribe to At Issue, the podcast, for extra content, including the panel's take on the fiscal update, which also happened this week. How does Canada recover while still battling COVID?
We'll ensure we have the weapons we need to finish the fight against COVID-19. An effort more urgent now than ever with the surge of Omicron.
You can find that conversation on any major podcast app and our website, cbcnews.ca/thenational. Now back to Adrian and Andrew in Toronto.
All right, thank you, Rosie. COVID cases are soaring in the UK, too. Now the Queen is taking precautions. Coming up, canceled events and closed borders, how Europe is dealing with an out-of-control variant. Plus,
I've worked constantly since this started, but it's mostly for refunding.
Travel thrown into turmoil once again, how Canadians are coping with the new advisory. Stay with us. Welcome back. For the second day in a row, Great Britain is seeing more COVID-19 cases than ever before. But so far, no new major restrictions.
We don't want to make your choices for you about your social life. We're not closing things. But what we are saying is people should be cautious and they should think about their activities in the run-up to Christmas.
Britain reported more than 88,000 new COVID-19 cases today, an all-time high. But the country also set a new single-day record for booster shots given. More than 745,000 people got theirs on Wednesday. Still, concern over Omicron's rapid spread weighs heavily. This week, the Queen canceled her traditional pre-Christmas family lunch out of an abundance of caution, while France imposed tough new travel restrictions, effectively banning all non-essential travel from the UK, with British arrivals required to provide a negative COVID test taken within the previous 24 hours.
Europe is definitely a ticket to nowhere for some Canadians. Ottawa's new advice against non-essential international travel is wreaking havoc on vacation plans. As Julie Wong explains, many are canceling trips, while for others, it's keep calm and pack carry-on.
Craig Savage was excited to escape frigid Alberta temperatures with a trip to California. He and his wife booked using travel credits from trips canceled at the beginning of the pandemic. Their flight left Thursday, one day after the federal government advised against non-essential international travel. They were not on it.
So we thought we just really didn't want to risk it, and also our health as well.
It's a similar story for Ashley Robinson. The Calgary woman is eager to redeem her soon-to-expire credits from a 2020 trip, but now travel in general makes her uneasy.
I am a single mother, so I'd be traveling with my child, and I just worry that we would be stranded.
It's a sentiment playing out across the country as Omicron tightens its grip.
Now is not the time to travel. But the reality is we have to think about COVID. Omicron means we have to be even more careful.
The pandemic has been a roller coaster for the travel industry, from the early days of canceled flights to evolving travel rules. Now travel agents are scrambling again.
We're in this constantly. There hasn't been, I've worked constantly since this started, but it's mostly for refunding or trying to get people rearranged for a new vacation that, of course, gets canceled again.
Some people are still going ahead with plans. Randy Way and his wife are going to Mexico for a family ceremony.
It's an advisory, but for both of our mental health and our well-being, it's an important event, and we'll have to manage the risk.
Canada's Level 3 travel advisory encourages Canadians, regardless of vaccination status, to avoid all non-essential travel outside of the country. Travel agents we spoke to say some travel insurance would cover cancellations and medical care, but some won't. The advice? Check the fine print. Julia Wong, CBC News, Edmonton.
Well, farmers in P.E.I. may have to destroy millions of potatoes after Ottawa hit them with an export ban.
Are we frustrated with how Ottawa is dealing with this? Absolutely.
We'll tag along as he makes his case in Washington.
Plus, call it the reindeer games, the video you have to see. Stay with us. What a song. That Bruce Springsteen classic now belongs to Sony Music. The entertainment company has reportedly bought the rock legend's entire music catalog for a whopping $500 million. That deal could be the biggest transaction ever struck for a single artist's body of work. Also in the USA, the premier of P.E.I., because the clock is ticking for his province's potato farmers sitting on a crop they cannot export after Ottawa hit the key industry with an export ban. The federal government says it was the least bad of the options after a fungus turned up in a couple of farms. Now the premier is appealing to American lawmakers for action. Katie Simpson met him in Washington.
Good morning. P.E.I.'s premier traveled all the way to the U.S. Capitol to drive a message back home to Ottawa.
Keep spreading the word about our potatoes and how healthy and good quality they are and how they should be here in the U.S. in the shelves.
Dennis King met with a handful of American senators and stakeholders to assure them if Canada's potato export ban is lifted, it will pose no threat to U.S. consumers, using the moment to fire a shot at the federal government.
And so are we frustrated with how Ottawa is dealing with this? Absolutely. And it's time to, get rid of this silly BS and let's get to work and get this open, because if we're really Team Canada, let's act like Team Canada. That they have confidence.
To illustrate his point, King told a table of reporters it's a little bit offensive that Canada's ambassador to the U.S., Kirsten Hillman, asked him to raise Ottawa's opposition to the proposed American electric vehicle tax credit during his meetings about the potato crisis in his province.
I do find it very concerning that that was discussed when, given the circumstance we're in and what our farmers are facing.
The Canadian Food Inspection Agency imposed the ban on P.E.I. potato exports to the U.S. after potato wart was detected in 2 fields last month, fearing the U.S. would impose a ban of its own that would be more difficult to lift.
We're working around the clock with our team. I just had a meeting with the U.S. ambassador.
The federal agriculture minister says this is a priority, and it has been raised at the highest levels multiple times, though she doesn't expect it to be resolved before the new year.
I think it is ambitious by the end of the year, but we are working on a path forward. It might be solved in different phases.
The timeline here means it's likely some P.E.I. potatoes will have to be destroyed. Katie Simpson, CBC News, Washington.
Well, after the break, a Christmas tradition gone sideways when wildlife takes the decorations a little too seriously. The story behind the video in our moment. Well, that's nice, isn't it? That's really nice. Rudolph, nose shining bright. Until, that is, things took a decidedly un-Christmas-like turn. We've been showing you throughout the newscast how this story ends, but what you haven't heard is how mysteriously it began. It's our moment.
I come home and I noticed that he was laying down because he has a very bright red nose, and I'm thinking, that's not normal. I picked him up and I'm like, okay, his legs are off. So I went and got my husband and said, look at this. So we ended up looking back at our doorbell camera and seeing this. And I went, oh my goodness, a buck attacked him. I'm like, I got to put this on Facebook. And it just has gone viral. Every year somebody comes in, tries to show him who's boss. So we put him together with contractors adhesive, and he just, every year he keeps going. It's an older 3D archery target. And we always stuck it out there just for fun, put him back together, and he's now standing proud again. It's just humor. It's like he jumped the first time, and then when he went back the second time, I'm like, oh my goodness, here he goes. It's a good laugh, and a lot of people are really enjoying it, and it's something funny.
Poor guy.
Okay, stop picking on Rudolph. 2 theories as to why this is happening. One, that he appears during mating season. The male bucks are competing for female attention.
And what's the second one?
Oh, he has an excellent set of antlers.
Yeah, I guess I can't argue with that. That's the national for this December 16th. Have a great night.
Good night.